Hello. As you can see, this presentation is about antibiotics, specifically why you should not take them for every so-called infection. The reason why I thought of doing this topic is because indiscriminate use of antibiotics has become a major problem all over the world, and I think it's a bigger problem here in India. So let's try and learn a bit about antibiotics and also find out why they are not necessary for every infection. So what exactly are antibiotics? These are medicines that are used to treat bacterial infections. Similarly, we have antifungals, medicines used to treat fungal infections, and antivirals are medicines that are used to treat certain types of viral infections. There are many different types of antibiotics available, as many of you already know. This some of you may not be aware of. Each antibiotic works only against certain bacteria. The effects as well as the side effects of antibiotics vary considerably from one another. This is a very important message that I'd like to convey, and that is antibiotics are not effective against viruses. There are different kinds of microorganisms, disease causing microorganisms. Bacteria are just one of them. There's many other kinds. Viruses and fungi are some of the other kinds of bugs that cause infections in the human body. So when you take an antibiotic for a viral infection, it will not work against it. And by the way, colds that we so commonly encounter throughout the year are almost always caused by viruses. And there is no antiviral medicine that's available in the market for treating colds. Now, flu or influenza is also a cold-like illness, except that the symptoms are much more severe, associated with high-grade fever, body aches, and so on. There are medications to treat this particular type of viral infection, but what I'm talking about is mostly the garden variety colds, low-grade fever, cough that we all experience during the winter months mostly. And these are caused by viruses, and there is no antibiotic available that is going to make this cold go away any sooner than just letting it take its course, which usually lasts about 5 to 7 days. Let's talk about proper usage of antibiotics for commonly encountered infections. Keep in mind that before you take any type of antibiotics, consult a good physician. Find out if there is any need even for taking an antibiotic. Self-treatment or chemist-advised treatment can be dangerous. Going to the medical shop and asking the chemist there to hand you a prescription for an antibiotic is not the right way to do it. You're in fact harming your health by doing so. And also keep in mind that there is absolutely no need to take antibiotics for routine colds and coughs that we all encounter during the rainy season and the winter months here in India. These infections are mostly caused by viruses, and they'll get better on their own within a week or so. If for some reason you believe that the symptoms are getting worse, you will need to first see your doctor before taking any antibiotics. And taking antibiotics for viral infections will not make the symptoms go away any faster. It's still going to last just as long, which is usually about a week or so, and then it'll get better. Now there are situations where antibiotics are needed, again upon the advice of your physician. And these are commonly treated outpatient bacterial infections where antibiotics are indicated. I have detailed them on the screen. Bronchitis is one such infection. Ear or a throat infection. Pneumonia, urinary tract infection, skin infections, and so on. Now, majority of these bacterial infections that warrant treatment with an antibiotic in the outpatient setting do not require very powerful or costly antibiotics. And this is something that you have to keep in mind, because there are times when unfortunately some physicians will prescribe very expensive or broad spectrum, what we call, antibiotics, which are not really necessary for treating some of these infections. So finding a good physician who'll do a thorough examination, listen to your concerns, and give the right kind of advice is absolutely essential. Antibiotic overuse is extremely common in India. A doctor's prescription is not needed really to get these medicines, or many other medicines for that matter. Patients, doctors, medical shop personnel, I believe all are responsible for this problem. There is no real awareness amongst the general public regarding the dangers of antibiotic overuse. Misconceptions are plenty. People believe that for every cough and cold, if you take 1 or 2 doses of an antibiotic, the infection will get better, faster. And unfortunately, there is non-existent public or patient education regarding this issue. And not only overuse, improper use is also a big problem. Most people do not take the full course. Sometimes they take it for maybe 1 or 2 days and believe that since the symptoms are better, there is no need to complete the full course. And sometimes they'll continue to take the antibiotic till they start feeling better and then abruptly discontinue. Not the right thing to do. What could happen? Why is antibiotic overuse dangerous, or why is it that we have to even talk about it? What's going to happen is that when you take antibiotics too often, or you take short courses, do not finish the course that is prescribed for that particular antibiotic, and remember that each antibiotic has its own course. This will wipe out the healthy and friendly bacteria we carry within our bodies. Not only that, this will make us more susceptible to various infections, some of which can be deadly. And taking antibiotics for every so-called infection can also lead to the development of antibiotic resistance. And when bacteria become resistant to the common antibiotics, more powerful antibiotics will need to be used to treat the same bacterial infections. So basically, we'll be needing stronger and stronger antibiotics to treat the same simple infections, because the bacteria have now become resistant from having taken antibiotics so frequently over so long a period of time. So what's going to end up happening is that we will keep needing to use more powerful antibiotics to treat these resistant bacteria. These the so-called newer generation antibiotics, which tend to have serious side effects. And not only that, they will certainly be a lot more expensive than the much cheaper, simpler antibiotics that unfortunately are now not working any longer. So powerful antibiotics, more powerful bacteria, even more powerful antibiotics, even more powerful bacteria. So this cycle will keep on and on and on until we reach a point when there are no more antibiotics left to treat the superbugs. That's a frightening situation, isn't it? Now, this will certainly mean that costs will go up, certainly. Hospitalization, lengthier stays in the hospital because infections are hard to treat now, and longer time for recovery from infections. Now, keep in mind that not all bacteria are bad. Bacteria can be good for us too, you know. Did you know that we need certain types of bacteria for normal body functioning? For example, many of you may have heard of lactobacillus. This lactobacillus species is one kind of very friendly bacteria that we all carry in our digestive system. It's extremely important that we have enough quantity of these bacteria for proper digestion of food. Now, a lot of People may have heard of Sporlac. It's a commonly used anti-diarrheal medication in India. This Sporlac is nothing but lactobacillus in the form of a tablet, and it is used for treating diarrhea that is oftentimes caused by taking antibiotics. So we are actually letting bacteria build up in our system to combat the side effects from taking an antibiotic. Kind of doesn't make sense, but that is true. So there are healthy bacteria, and these bacteria are essential for the functioning of our body. Now, they also provide immunity against lethal infections, these healthy bacteria. So what is antibiotic resistance? We talked about it very briefly in one of the previous slides. What's going to happen is that when antibiotics are used indiscriminately, very frequently, and especially when they are not necessary, that will lead to resistance. What resistance means is that the antibiotic will not work against the bacteria that it is supposed to kill. And we just talked about having to use more powerful antibiotics for simple infections. And sometimes we may have to use a combination of antibiotics to treat these infections also. Treatment, of course, becomes more expensive when you start using the newer generation antibiotics. And of course, possible hospitalization if the infection keeps getting worse. More side effects, more complications. And one very scary scenario is when multi-drug resistant bacteria develop and leading to potentially lethal, life-threatening super infections. It's not just one person that's affected, but the entire community around that person might actually develop resistance. So it is indeed a very scary situation. I'm certainly not going to end this presentation on a scary note. What I'd like to instead do is talk about some positive, constructive steps we can take to prevent infections. And here I'm not talking just about bacterial infections, I'm talking about infections in general. Now, the single most important thing we all can do is to wash our hands properly. And this can be done with any kind of soap. And of course, clean water needs to be practiced by everyone, everywhere. In households, in schools, in theaters, in fast food places, in restaurants, in hospitals, clinics, everywhere. And especially before cooking or handling food, especially before eating, especially after using the toilet, after handling garbage, after blowing nose, after examining a patient. Doctors, please take note, and so on. Safe drinking water for all. This is so very important to avoid many gastrointestinal infections. And I think by promoting usage of cheap, effective water purifiers, this problem of unclean or unsafe drinking water can be to some extent taken care of. And of course, proper handling of food is so very important everywhere. Cooking conditions need to be hygienic, and proper storage of food, and again, paying attention to hand washing, and of course keeping your surroundings clean. This is a no-brainer. Everyone knows to do that, right? But it is not just your home, it has to be the whole neighborhood. Make sure that your colony is garbage free. Make sure that the garbage is dumped in the designated dumping bins, and make sure that there are clearly visible dustbins in every nook and corner so people don't drop garbage wherever and where they please. Instead, they'll use this garbage bin to dispose of their trash. And let there not be any standing or stagnant water in your colony. Some of these are easy to do and some are difficult, involves a lot more effort and government support and so on. But where there is a will, there is a way. So we all need to strive toward keeping our surroundings, again, not just our homes, but the surroundings absolutely clean and free of trash and garbage. And maintaining smoke-free environment. I'm talking about both smoke emanating from cigarettes as well as pollution, and that is going to go a long way in improving our immunity and making us more less susceptible, I should say, to infections. And maintaining a green cover everywhere, making sure that we don't cut down trees, make sure that we plant new trees so there is enough green cover to provide us with the life supporting oxygen that we all need to live. It's extremely important. And lastly, I'd like to end by saying, do not forget to practice hand washing, promote hand washing, and propagate hand washing. Thanks for listening.